In UMC, safe surgical practices are considered especially critical. In the operating room, the dedicated staff who care for the patients are part of an elite group known as the OR surgical team. These are their stories.
Dr. Farag, the surgeon is ready. Are we ready to go to sleep?
Yeah, this patient doesn't have an access. I'm gonna place the central line first.
All right.
Okay, let's go quick. Surgeon is rushing us. Okay. Okay. We need a finder. Okay. Wire. Okay. Give me a knife.
There's a knife and a dilator.
Knife back. Oh my
God.
goodness, what happened? You stuck your...
Got a knife
I'm
stick.
sorry. Okay, we need to stop
It
now.
doesn't look that bad.
Okay, just take off your gloves and stop and just go wash your hand. I'll take care here. Anybody else?
Like this?
Yeah, take off your gloves.
Thank you. It says minor cut.
No,
It
you
doesn't
have to
hurt.
wash your hand. No, wash your hand.
Hey,
What's going on?
don't you know the surgeons, aren't you tired of the surgeons telling you it's always anesthesia's fault and everything's going slow? Don't be slowing down for that guy over there. He put his hand out there. He doesn't know what he's doing. It's all about you, man. $200 a minute's what this thing's costing. You need to move on. You don't want those guys yelling at you anymore.
Oh no, you can't be rushing. You gotta think about safety first. You know? Needle sticks, knife sticks, we have to be careful. Always tell everybody what we're doing, put it back, pick it up easy.
Work in an area with adequate lighting. Before handling sharps, assess any hazards. Get help if needed. Keep the exposed sharp in view. Be aware of people around you. Stop if you feel rushed or distracted. Avoid hand passing and use verbal alerts. After exposed to blood, body fluid, or sharps, notify the charge nurse. Wash exposed site with soap and water. Express blood if it is a cut. Draw blood from patient source using red top tube. Place patient label with surgeon's name marked out on the tube. On a piece of paper, write exposure. EH will call or fax the orders. Place the tube in the biohazard bag and the slip on the side pocket of the biohazard bag. Send it to UMC lab. Call employee health or the house supervisor for after hours or weekends. For UMC employee, fill out the employee incident report. For contract workers or visitors, students not from TTU HSC, fill out the unusual occurrence report. Do not go to EC if EH staff or house supervisor is available. Go to EC only if the injury is severe or after hours if HS is not available and need PEP meds. Contract workers or visitors with exposure has to contact and notify their agency or school of the exposure. Supervisor should follow through. This UMC employee health exposure flowchart is found in every OR room.
So how much longer do you think this is going to be?
Probably about 10 more minutes. Just want to hold it.
What happened?
What happened?
No.
What happened? No, what happened? Did you get
I
stuck?
may or may not have stuck myself.
Okay, you need to break, scrub, and go wash your hands.
All right.
Hey, don't be slowing down for anything. All eyes are on you right now. This is all about you. You need to hurry. Don't you get tired of what that guy's name, Halderson? Don't you get tired of him yapping on you all the time about how slow you are? Keep moving. If somebody sticks their hand down there and they get stuck, that's their problem. They didn't have any business putting their hand down there anyway. Come on, let's get out of here.
You know, you can't hurry. We have to watch everybody here. It's a team effort. We have to take our time. We have to watch the end of that needle, especially a big needle like that. Somebody's got their hand in the belly and really should have had a retractor there. We've learned a lesson here. Next time we have to be careful.
Work in an area with adequate lighting. Wear 2 gloves, one over the other, using a glove indicator underneath. Use a neutral zone or a hands-free technique for passing sharp instruments, blades, or needles. Use safe scalpel handling methods. Use a no-touch technique when handling sharps. No recapping of hypodermic needles. When a safe needle device is not available and recapping is required, a one-hand scooping recapping must be used. Blunt needles should be used unless clinically contraindicated. Use of alternative cutting device. Use additional sharp safety practices such as maintaining situational awareness of all sharps on the sterile field, communicating the location of sharps, removing suture needles from the suture before tying, retracting tissue with instruments, handling saw blades, sharp K-wires, burrs, and other sharps with caution, covering the exposed sharp ends of pins, K-wires after it passed through the patient's skin with protective cap. Any TTU HSC employee exposure in the OR, please give this link for the employee to log in and fill out the online form. If employee prefers to fill out the paper form, packet is available in the holding area. Then send employee to TTU HSC EH. Draw blood from the patient source using red top tube and apply patient's ID label on the specimen with the physician's name marked out. On the slip, write down exposure and lab requisition will be called in by EH or house supervisor if after hours or on weekends. Send specimen in a biohazard bag to UMC Laboratory ASAP and inform UMC Laboratory that UMC EH will call or fax the orders. Call UMC EH or the house supervisor if after hours or on weekends to notify of the exposure so they can fax or call UMC Laboratory for the orders. TTU HSC employee goes to TTU HSC EH during business hours, 8 a.m. to 4 p.m. TTU HSC student goes to TTU HSC IH during business hours, 8 a.m. to 4 p.m. For after hours or on weekends, UMC House Supervisor is the point of contact. For any questions, call TTU HSC EH or UMC EH at the numbers listed. This is the Texas Tech exposure flowchart found in every OR room.
All right, bed is locked. We are ready to wake up now.
All right, well, can you go ahead and call for an anesthesia tech? We're going to transfer to the ICU.
Can I get an anesthesia tech to one? Thank you,
All
back.
right, I'm going to get him back breathing.
You needed an anesthesia tech for transport? What do you need?
I just need to get everything ready, the oxygen cylinders, get the monitors ready. Hi there. How you feeling?
Hey, aren't you tired of this case? I'm getting tired of this case. Jerk that tube and let's get out of here, man. The time is money. And you got other cases to do. You'll be here all night at this rate. Jerk the tube.
Can you open your eyes for me?
It's okay, just take your time. Safety first. Always have to think about the patient first. Okay? It's all teamwork. You have people here to help you. You get all the time in the world. Take care of that patient.
Please, let's get out of here.
All right,
Jerk the tube.
I'm just gonna take the tube out.
Lord
Let me get
have
ready.
mercy.
All right, big deep breath.
Oh!
Ooh, yes!
Pantry, come on, man!
I'm so sorry.
Work in an area with adequate lighting. Wear a protective face shield. Maintain situational awareness.
My name is Kevin Rush. I am a first assist in the Department of Surgery at the Texas Tech University School of Medicine. And the people in the OR Education Office asked me to talk a little bit about my own personal testimony, so to speak. involving sharps and exposures and universal precautions and things of that nature. I got involved working in a hospital back in the spring of 1973, just getting out of high school. Went to work in a clinical lab, did a lot of phlebotomy. Back then, we were still using glass syringes for many things. There were no protective devices on caps for needles. And basically the only thing we got was be careful, don't stick yourself. As the profession moved into the early 1980s, AIDS arrived on the scene and changed everything for everybody. And much greater attention has been placed on universal precautions and sharps exposures. I got involved working in the operating room back in 1979, and once again, there weren't any safety devices on any of these sharps products like you have today with scalpels and needles and things of that nature. It's really critically important for people, and I talk about this a lot with the interns and the med students, that if you do not have to handle sharps with your hands, don't. And there's very seldom any reason to handle sharps with your hands. You can always use forceps to handle a needle, obviously a needle holder to handle a needle. You don't need to be recapping unless you just lay it down on a Mayo and then, keeping your free hand away from the needle tips and things like that. There's all different kinds of techniques that have been developed now to safely deal with sharps. Probably the most important thing that has come about is through the AORN and their strong recommendation of everybody double gloving. Double gloving is not going to prevent you from getting stuck, but the double glove has a wiping effect, and it will reduce the amount of material that could be transferred during the puncture. So it is strongly recommended that whenever you go into the operating room, do double glove. You need to try to coordinate your actions with whoever's operating. If you're assisting and they're suturing and you're trying to follow, be very conscious about where those needles are going and things like that. But probably the most important advice and suggestion that I can give anybody is to always use something besides your hand to handle sharps. I've been stuck countless times, and I have been, knock on wood, very fortunate not to have any kind of conversion. But there was one time when I got stuck with an 11 blade, quite by accident, and quite often all of these needle sticks and knife sticks and things like that are through your own personal negligence in some way. But I managed to get dinged with an 11 blade, and I asked the surgeon at the time, is this patient clean? Is he okay? And he said, yeah, as far as I know, he's fine. So I go and do all of my paperwork, and I just kind of ho-hum it. Well, it's another stick. We're good to go, and move on to something else. And I'm on the way home, and I get a phone call about 5 o'clock, and it is from the employee health department, and they say, Kevin, you need to come by and see us tomorrow. We need to talk about this needle stick. This guy's Hep C positive. So now you're going to be losing sleep, and your significant other, boyfriend, girlfriend, wife, husband, whatever, if they're not in the medical field, they're going to be freaking out. You're going to be curtailing or modifying your extracurricular activities at home, if you get my drift. And it's really going to put a lot of stress and strain, and you're going to have to get some blood testing done over the course of a year to make sure that you don't convert. And it's so easy to avoid all this. So be very conscious about what you're doing in the operating room. Use all the safety precautions that are there. Don't take any unnecessary risks. And if you do and you pass that on to others and preach the gospel, it's going to be a safer environment for everybody.
I conquered Satan.